Hi, I'm Steve Morgan, founder of Cybersecurity Ventures and editor-in-chief at Cybercrime magazine. I'm here today with James McQuiggan, security awareness advocate for KnowBe4, the world's first and largest new school security awareness training and simulated phishing platform that helps you manage the ongoing problem of social engineering. To learn more about KnowBe4, visit knowbe4.com. James, welcome. Great to have you with us today.
Great to be here. Thanks.
So, James, we're here to talk about something heartbreaking and catastrophic. This was reported in an Associated Press news release from September 17th, and I'm going to read from the release. German authorities said that an apparently misdirected ransomware attack caused the failure of IT systems at a major hospital in Dusseldorf, and a woman who needed urgent admission died after she had to be taken to another city for treatment. James, is this a wake-up call for our industry and every CISO and security practitioner in the world around the harm that ransomware can inflict?
I think this wake-up call has actually been going on for quite some time. Ransomware kind of made a resurgence about 4 years ago with the creation of the Bitcoin wallets, and a lot of the cyber criminals realized, hey, we can get money and keep it anonymous, and nobody can track us. And so ransomware kind of become more of an attack vector to these organizations. And then late last year, we see that ransomware is going nuclear because they're now coming in and not only making your data unavailable, but they're stealing it as well and holding that for ransom, as well as having you be able to decrypt the data. But now they're holding it hostage, and whether they release it or they sell it, they've kind of stepped up the game. But I think with a lot of healthcare, a lot of the hospital organizations, they're working by their risk mitigations. They're working with what the board is able to provide them. They're also working by what they've got to comply with. And so while I think that, the wake-up call has been going on, I think a lot of organizations are just kind of hitting the snooze button, hoping that they're not going to get hit with ransomware, even though, you don't have an IT organization or an information security organization there to do the least amount of work, but you're doing it so that you secure those environments. And even the hospitals themselves, they want to make sure that they're taking care of their patients, reducing that level of infection that can get into patients. But at the same time, there has to be that reducing the level of infection coming into the IT systems as well. So I think it's been sounded. People know about it. They're doing what they can to mitigate it, and they, just keep hitting that snooze button.
Now, do you think that people meaning patients, people meaning CISO, security leaders, have been able to connect the dots between ransomware and the idea of someone actually dying?
Yeah, I think, when you look at the cyber criminals, they're doing this for the money. They know if they're going to hit a hospital, they know if they're going to hit healthcare organizations, that they are, is that likelihood that somebody's going to die? I don't think they're really thinking that. With other instances in the past when they've hit hospitals, they're hitting them because they've got money, they've got personal identifiable information, they've got patient information, and so it gives them an opportunity to go in and steal that. And then we've even seen cases where they've gone after the patients themselves, the people whose information they've stolen, and are trying to get ransom money out of them to help fund their own causes. So, when it comes to understanding that patients' lives are at risk, the healthcare and the hospital organizations, they're already dealing with that on a day-to-day basis. But from a cyber criminal standpoint, they're just in it for the money.
So, James, after this particular ransomware attack, we had quite a few emails. Some of them came from CISOs asking us, exactly what happened. I think you can probably do a much better job than I can breaking this down. I know
Sure.
You read some related stories. So for the CISOs out there, and also for C-suite and even boardroom executives who may not be familiar with a lot of the lingo in our industry, what happened?
So the attack that occurred, or that was discovered by the hospital, they announced very early the morning of September 10th. It was about 6 o'clock German time. that they posted on Twitter and other social media that they had been hit with an IT attack and their IT systems were down extensively. So you take a step back and, from an IT perspective, from an information security perspective, they most likely discovered the event had occurred. Their systems had gotten impacted the night before. Because most likely they discover that their systems are becoming encrypted. They're no longer able to access them. They're becoming unavailable. And then they pull together their legal teams, their communication teams, IT. Most likely the C-suite has been notified and communicated with to say, we've been hit with ransomware. This is what's happening. But then they also have to get the word out to the community because hospitals are a 24-hour, 7-day-a-week operation. And they've got to let the public know. So communication goes out first thing on September 10th, the Thursday morning. And by midday, they're hearing more. They actually deregister from the emergency care. So any emergencies that have to come in, they have to be rerouted elsewhere. They announced that the ransomware note had been left on the servers. And most likely the ransomware note is going to contain information on how to contact them. Usually, sometimes with ransomware notes, we find how much they've got to pay and where it's got to go. Some of the cyber criminal groups like to operate where they just say, here's a website, you need to go visit this, all the information will be there. It's a lot easier for them to deal with. The hospital contacts the authorities, the government, as well as the BSI, which is the German Information Security Federal Office, kind of like our FBI. But they contact them as part of their protocol to say, hey, this is what's going on. And by the next day, the hospital's only offering limited care at the hospital. To me, I took that as they weren't taking on any new patients. They had already released that. And basically said that, okay, we're going to take care of the patients we've got without the systems available for them for information about medical history or other medical information that they would have access to. They're probably doing everything by hand, by paper at that point, and taking care of the patients that they've got. And then on that Friday night, we had the unfortunate situation with the woman that would have gone to the UKD, the University of Dusseldorf Hospital. She would have been routed there, but either through some miscommunication or whatever, she is then routed over to Wuppertal, which is the next closest hospital for them, which takes that an hour for them to get there. And unfortunately, in that time, the woman ended up passing away. Now, I think a lot of it, we read that headline, we read those sentences in the articles that talk about, diverted, the woman died on the way. And I think some folks get the impression in their head that, they showed up to that Dusseldorf hospital and they were turned away. And then they had to get back in the ambulance and then drive to the other location. I think what ended up happening was they were en route, missed the communication or whatever that there was there, and then ended up being rerouted. And unfortunately, we have the passing of the patient, the woman. One interesting thing that came out of it, when they looked at the ransomware note, one of the things that they noticed was the name that it was addressed to was a different university hospital there in Dusseldorf. It was the Heinrich Heine Hospital. And once they got BSI involved and the police involved, they reached out to the cyber criminals to say, "Hey, you've hit the wrong hospital. We're the University Hospital for Dusseldorf, not the Heinrich Heine one." At which point, so interestingly enough for me, the cyber criminals turned over the decryption key.
Huh.
And essentially they're saying, sorry, we hit the wrong one. Sorry, here's the key to decrypt your files. So this is happening on September 11th, and they start the whole decryption process, and pretty well takes them through the next 2 weeks to get all the servers decrypted.
So, it's difficult to have a conversation about this. We're in technology, we deal with cybersecurity, somebody died. We don't want to sensationalize that. It's certainly, not the purpose of the discussion. However, it, highlights the risk that we have. And setting aside this particular incident, the red lights, the red alerts have been going off for a while. I don't know if everybody's been paying attention to them, but all the way back in 2016, there was an incident at Hollywood Presbyterian Hospital in Los Angeles. Right. And we had a situation where the oncology equipment was down. Patients couldn't be treated. Nobody died, but
right.
It highlights the risk. So how prepared, in your opinion, are hospitals? Do they have plans in place where, there's a ransomware attack, the equipment goes down, there are incoming patients, there's other patients who need to be treated?
Yeah, from a hospital perspective, healthcare organizations, their IT organizations, their cybersecurity divisions, they have plans in place. A lot of the times they're going to have a incident response playbook. And, in the event that X happens, you follow essentially this recipe out of the playbook. And so in the event that it's a ransomware attack, they follow certain procedures. Now, with regards to, what happened with the Hollywood Presbyterian with Lockheed, there was a study done by Vanderbilt with regards to data that they collected from Health and Human Services, the government office. And they did an analysis of EKG data that had been collected from patients on the echocardiogram with regards to how responsive the tests were done. Usually if somebody's coming in with a heart attack, they've got to get an EKG done within about 10 minutes.
Right.
And one of the things that they were noticing in the data, if a hospital had been impacted by data breach, the work that was being done post-breach, the new programs that were in place or the new procedures that were in place, they were noticing that there was a delay of about an average of about 3 minutes in getting those EKGs done. So, you got to get it done within 10. Now they were taking longer. And one of the things that they noticed was that out of about 10,000 patients, there was about 36 of them that ended up dying because it took longer to get that EKG because of new procedures or policies or programs that were in place after a data breach. So when we look at, this, what happened with the hospital, the Hollywood Presbyterian, we look at, UKD in Dusseldorf, the cyber attack that happened, slowed down a lot of things, put it to a grinding halt during the recovery process. But the after effects, ended up causing a death or deaths of other people. And it's whether we relate it to, oh my gosh, the delay in the EKG caused these people to die, or it was in the new procedure. One of the things that they do in the healthcare industry that I always find fascinating is if a doctor is doing an operation and the patient ends up dying, the unfortunate loss of life, one of the things that they do is what they call an M&M, a mortality and morbidity. Sorry, butchered the word there. But an M&M meeting. But what they're doing in that meeting is they're talking about what they did, what went wrong, and then how did they, what did they learn from that? And they have to present it towards all their colleagues. And I think within the healthcare industry, if that same type of practice, I think in all industries, it would be great. When you have an organization that gets hit with ransomware or they're hit with a data breach, that, that M&M can occur, whether they present at a conference or it's done internally, but to go over what was done, what were the lessons learned, how do you make sure that it doesn't happen again? How can other healthcare organizations learn from that? And in those M&Ms, there's no criticizing, there's no pointing fingers, it's all stating the facts. This is what happened, this is where, what the end result was, and this is what we learned from it. Those kind of scenarios, those kind of examples can help other organizations learn from it as well. Whether it's a ransomware attack because of an open RDP port, or because somebody clicked on a link, or some other misconfiguration or other human error. Being able to learn from that and sharing that, I think, is important, so that other other organizations can learn from it and, hopefully implement to prevent the same thing happening with them.
So in your opinion, is this a talking point in the boardroom at hospitals, the board of directors, the C-suite executives? Are they preparing for this at that level? Do they recognize how serious this is? You're talking about a situation where not only is there potential for a loss of life, but we're also in the midst of a ransomware epidemic where, this is growing 5x over a 5-year period. We track this very carefully from 2017 to 2021. The number of ransomware attacks are on the rise. The nature of the attacks are changing. They're becoming more sophisticated. Are they talking about this? Are the C-suite execs talking about this?
To my understanding, they are. In research that I've done and conversations I've had with colleagues in the industry, these conversations are going up to the board, because when you get hit with a ransomware attack, it's impacting your brand, it's impacting your revenue, and of course that comes out with your reputation. But over the years, we've seen all these organizations hit with data breaches or ransomware. Some, if they end up being down for so long, they end up having to bankrupt. So the board recognizes that this is a concern. They recognize that that is a valid threat. It comes down to, a lot of them is, how do we mitigate that risk? How do we make sure we don't get hit with ransomware? And so whether they introduce security awareness and training programs, phishing assessments, additional technologies within their environment to be able to secure the network. But I think a lot of the time they may be limited by certain regulations, because there's FDA requirements, you've got HIPAA requirements that occur in healthcare that they've got to comply with. Systems have to be tested before they can be, allowed on the network. So when new patches are coming out, they can't patch right away on a lot of those internal systems. And sometimes that causes the delay where the cyber criminals recognize that hospitals aren't spending as much money as other organizations, other verticals like financial organizations or energy corporations or whatever. But if they see that there's an opportunity to strike, they're certainly going to take it, because for them, they're in it for the money. They are, but yeah, the board's aware. They're working with their CISOs, hopefully, and looking to make sure that they're securing their perimeters.
Well, you make a good point about spending and budgets. There's only so much money to go around. Hospitals have been struggling with digitizing patient records, and there's a lot of compliance regulation. I believe that somewhere in the neighborhood of 5 to 7% of the IT budget is allocated to cybersecurity, whereas when you look at financial services, it could be 15% or upwards. So clearly there's a financial challenge. KnowBe4 works with a lot of healthcare providers. So, when you're called in, if you're working with a new client or an existing client, and they read about what happened a few weeks ago, and they have elevated concerns, I guess where's the starting point for a new client that you're advising, and what are you advising to clients who are already working with you?
So for a new client, when we start working with them, the first thing to do is to go ahead and get a baseline. Let's figure out, because with security awareness and trainings, we are educating them on, social engineering, phishing attacks, all the internet dangers, all the different threats that, can impact them. So the first thing that we do is we want to do a baseline assessment. And so we send that first phishing attack, and it's the IT folks in the organization that are doing that. But we have a team of people that can work with them on which phishing email or template to select. And so you send off that first one, and you get what we call a phish-prone percentage. And essentially, that's the number of people that end up clicking on a link, divided by the people that don't click on the link. And one of the things we've noticed within healthcare, right out of the gate, a lot of them are, in the 40s, 40%, 42% of the people are clicking on the link. So, you think about it, that's almost 1 in 2 people, 1 in 3 people are certainly clicking on that link, which is a lot when you think about your exposure to the internet. If you've got 1 in 3 people that are going to click on a link inside that organization, you're going to send in a lot of those phishing emails. Once you've done that first phishing assessment and you get your baseline, how prone people are to fall to a phishing email, then you start the training. And the training isn't just that 30-minute PowerPoint presentation. It's interactive, engaging, what we call new school security awareness training that they go through, and it's repeated. It's not just a once a year thing. It may be repeated depending on how the organization works with it, but it goes through. It can be repeated quarterly, monthly, different topics. One of the things we have in KnowBe4 is our mod store with tons of training programs. We've got video series, all different ways for people to be able to learn from the different aspects of phishing, social engineering, and so forth. And so as they go through and they get that training, you continue to phish the employees, the people that are working in the hospital. And one of the things that we've noticed is that they end up going down from like the low 40s down to like 15% after 90 days. So it's a significant drop for those employees. And then after about a year, we see that percentage go down even further, down to just under 5%. So you go from a 1 in 3, 1 in 2 chance of getting phished in your organization to now 1 in 20. So your odds are getting a lot better. Your risk is reduced because now your employees are less inclined to fall for those phishes. So essentially, you're looking at almost a 89-90% improvement rate over being able to have your employees be phished. Now, if you're already a KnowBe4 customer, the mod store, as I already mentioned, is full of all different extra training programs geared to various industries, whether it's healthcare or manufacturing, construction, so forth. The Inside Man series, and I think we've now released the security snapshots, which are little 3-minute video clips that people can watch and gain extra information. When you think about healthcare industry, when you think about a hospital, and I have friends that work in the hospital in IT, but also doctors and nurses. And one of the things they do in the hospital is a shift change. They do that where they're reporting on how patients that they've been taken care of are doing, and then turning it over to the next nurse or doctor to do rounds and to take care of and monitor throughout the day. And one interesting thing for me, I'm coming out of the energy industry from about 18 years. And one of the things that was a big proponent there, and it's big in the hospitals as well, is all about health and safety. Within hospitals, they are working for the wellness of their patients to get them better and get them home. Within the energy environment, when it was building wind turbines and power plants, it was all health and safety, making sure people weren't having accidents, people weren't hurting themselves or dying from any injuries. Same thing in a hospital. They're working to make sure people aren't infected. One of the things that I noticed was with regards to health and safety in energy, every day in the morning, there'd be a staff meeting and there would always be a particular item that would be mentioned regarding health and safety. And I think in the healthcare industry, one of the easiest things that they could do is in those changeovers, you have somebody that presents a security tip. Whether it starts out with bringing your IT and InfoSec people in, or you have your nurses that are trained, they go, hey, this is what I learned today on how to make a secure password, or this is what I learned on what to look for on a phishing email, and they take that 5 minutes. Now what it starts doing with regards to health and safety, you have that health and safety culture. Now you have a strong cybersecurity culture. And doing that within the organizations can certainly go a long way, and not a very expensive program that you would have in place as well. But it increases that culture and certainly reduces that risk of a phishing attack or other type of cyber attack into your organization.
So in a hospital, there's obviously a lot of employees. You have administrative employees, people who are often strewn across multiple locations. The KnowBe4 content is phenomenal. So we make the basic assumption here that the employees are going to be engaged in a program. if there's any group of employees that I might be concerned about, and I'm curious, what you observe, it would be the doctors, it would be the surgeons. They're very busy people. They're mobile. They're moving throughout the day from patient to patient. Are hospitals engaging them as well as the nurses in that security awareness training?
From a security awareness training program, one of the things that we have, because of a lot of people in various organizations are very busy, your C-suite, board members, we have different lengths of the security awareness training program. So whether it's a 45-minute for office staff, we have a 15-minute version that's available, the Kevin Mitnick Security Awareness Training Program. We have a 15-minute version of that can be given to people that are very busy, don't have a lot of time, but at least we need to drive home the message so that they're aware of it. Because for me, a lot of the time awareness comes down to is if you know that there's certain things going on, you're going to take the necessary steps to make sure that you're either protecting, your systems, your email. For me, I always like to think that when in your own neighborhood, if you were to hear about a rash of burglaries going on and you're finding out that they're breaking in through, back windows, you're going to take certain steps to make sure your back windows are protected as well as all your windows, whether security device, security monitoring, cameras, motion sensor lights, whatever you end up deciding that you can afford, you implement those so that you can protect your home. When you realize that, okay, a lot of the times we're getting hit by we're getting cyber attacks is coming in through email, you need to make sure that you're aware of the different ways that phishing emails can occur. And it may not be something you do all at once. It might be, okay, every day or once a week, here's a new red flag to be aware of. And and then you have that part of your phishing assessment, to kind of keep driving home that message on a weekly basis if you have to, with regards to your phishing assessment, so that you have that little bit of nugget of information that goes out, and hopefully they remember it, whether it's a doctor or a nurse or an office staff, that they go, oh, I remember seeing that about the certain with attachments and wanting to enable macros. Okay, that's not something I need to do. I don't know who it's from. And so that can go a long way. It doesn't have to be given all at once, but it can be spread out to help your staff.
So a parting message for CISOs before we let you go, James. We're living in the COVID-19 pandemic right now. Obviously, there's a lot tugging at all of us, especially in the healthcare community, treating a lot of people. But I don't think they can let their guard down when it comes to ransomware. So any advice you have, any parting words for the CISOs listening?
For the CISOs listening, certainly you want to make sure that you're doing your vulnerability assessments. You're making sure that RDP ports aren't exposed to the internet. A lot of the time, even the FBI has reported that they see way too many RDP ports. The remote desktop protocol, these are your servers that are easily accessible from the internet. Make sure those aren't sitting exposed to the internet. We know a lot of the time, with regards to the Dusseldorf attack, that was done through a commercial piece of software, through their VPN software. There was a vulnerability, the patch came out. Unfortunately, the system wasn't patched. When it comes to your external facing devices, systems that are sitting on the internet, those you want to make sure that are up to date and patched first. I understand coming out of the energy environment with regards to compliance, your internal systems, they've got to go through certain testing and everything else, but you want to make sure you're securing your perimeter, you're securing that exterior wall of your home, making sure that there isn't those exposures, and if there are, you're getting them fixed as quick as possible. Within healthcare, there's always a big focus on hygiene, and carrying that message. I always think of cyber hygiene, making sure that the CISOs are passing that message of cyber hygiene to the staff, to the doctors, the nurses, office staff, to everybody, that make sure you're practicing good cyber hygiene as well as good hygiene. Okay, you're washing your hands between patients, especially with COVID, got the masks and everything else. But with your cyber hygiene, it's making sure you're aware of the red flags. You're not clicking on any strange links, and their IT team is making sure your perimeter is secure and there's no open exploits out there.
James, a wealth of information. I'm so glad we had you on today. Thank you so much. I hope we can do this again soon.
Definitely. Thank you very much.
I'm Steve Morgan, founder of Cybersecurity Ventures and editor-in-chief at Cybercrime magazine. Joining us today was James McQuiggan, security awareness advocate for KnowBe4, the world's first and largest new school security awareness training and simulated phishing platform that helps you manage the ongoing problem of social engineering. You can learn more about our sponsor, KnowBe4, at knowbe4.com. You can keep up with all of our media at cybercrimemagazine.com.